Last weekend, in actual fact, a group of doctors petitioned the government anonymously because they do not want their names known, and I guess because they're scared of the abuse that might come their way, suggesting that the current End of Life Act is not working in the way it should work, and that excludes numbers of people from being able to access it. We talked about that on the show last week. But it does raise the issue of, and during that discussion, obviously, the group of people that was most considered to be disadvantaged by the way in which the law was being interpreted were those suffering from motor neuron disease. Now, subsequent to that, a large number of people contacted me and said, gosh, that's A, dreadful, but also B, that they knew people who came from motor neuron disease and had come to the view that motor neuron disease now was a disease, if you like, that had become much more mainstream, whereas just, than in previous generations, I guess. I don't know whether that's as a result of public information or whether, in fact, it is some sort of fact that there are per capita more folk suffering from motor neuron disease than in the past. It did raise the issue with a lot of people of, can you please talk a little bit more about this, given that, and also given that there seems to be some sort of correlation between, and I guess it's got a bit more coverage actually, because there are now people starting to suggest that between high contact sports, boxing, rugby league, there might be some sort of link as well. Joining us anyhow to talk about these issues in general is the Chief Executive of Motor Neuron Disease New Zealand, Scott Arrol. Scott, thank you so much for joining us. Welcome to the show.
Hi there, Michael.
First of all, Scott, motor neuron disease I guess almost nobody would have known about it at the turn of the century, and now it's becoming progressively, we're becoming more aware of as a society. Is there something in this idea that numbers have grown exponentially, or is it just that we are getting more information?
I think it's more information, and keeping in mind that the disease itself tends to track population growth. So so if we look at, if we just split it up a little bit here, so 10% of, or up, approximately 10% of people that have or get MND, it's known as familial or it's genetic, so it's come through the family line. Mm-hmm. So that's 10%. The other 90%, the specific cause, largely unknown, can be a combination of factors, and also someone's disposition towards that affecting them, one or more factors that might impact on their genetic makeup, and they contract MND. So as an MND is a disease, so it's generally tracked as a percentage of population. So for in terms of New Zealand, we have approximately about 400 people at the moment living with it, and you will have more, say, in Auckland or Christchurch, but not necessarily because those places have a predisposition to people getting more of it. It's really there's a bigger population.
However, having said that, numbers in New Zealand would seem to be worse than international. Why is that? We're
slightly higher as a percentage of population than anywhere else in the world, and particularly the Western countries that track the disease. It's not really known why New Zealand would be a bit higher than anywhere else. There's some research to be done on that. That links actually to how research is funded in New Zealand for MND, and it's never enough. But in New Zealand's case, it's absolutely not enough. So. Some people say, hey, well, we should research that. Well, yes, we should, but research needs money to do that sort of thing. So there is some research, but then on that particular factor, but there needs to be more, and that needs to be funded.
Now, I'm under the impression, because I guess I've known motor neuron disease sufferers, that it's inevitably fatal. So it's a disease that if you have the appalling diagnosis of having got it, you will die of it. Yes?
Mm-hmm. Yes, yeah, it's a neurological degenerative disease. So it is definitely when you've been diagnosed with it and develop the symptoms, and then you get diagnosed, then there's your life expectancy will take whatever course it will take in terms of how it affects the individual.
And well, I think you say it on your own website that most people die within 2 years of having been diagnosed. So that's pretty quick.
Yeah, it is. It's really sort of 24 months from diagnosis, but diagnosis can take a while as well. So we tend to talk about life expectancy being an average of about 34 months from the onset of symptoms. So when you might start to notice some symptoms, and when your GP might suspect that you have MND, and sometimes that will take a little while because it doesn't manifest itself, sort of automatically or quite openly as MND. It can a GP or a health professional might sort of think it could be some other things. So there's other tests are done. Obviously, MND is kind of like the last resort as such, where they go, well, okay, now we need to refer you to a specialist or a neurologist, and there's a whole raft of tests that then happen in at the secondary level, and you can be on a waiting list if you're in the public system for a while, and then tests take a while as well. So
okay, but the difference between
diagnosis takes.
And the difference between motor neuron disease at the end of the day, Scott, and cancer is there's no alternative to death with motor neuron disease. At least with cancer, I can get treatment, and I have a percentage chance of beating the disease and getting well. Not so with motor neuron disease. So it is a dreadful diagnosis to have, but it's also a dreadful way to die. And I, when I introduced the voluntary euthanasia legislation to the House, 30 years ago, I think, which thank God now has been passed, I was specifically thinking of a couple of people I knew who were dying from motor neuron disease. And I've talked to sufferers subsequently, and they were always looking at voluntary euthanasia legislation as at least being a backstop that they had there, and it gave them a degree of surety, I guess. It was thank God that's there if I ever need it. But now we discover that the legislation is deficient and that it almost excludes motor neuron disease sufferers. Have you considered that at all as part of your organisation?
No, not specifically. And firstly, people live with MND. Sure, they will die of it, and there is no known cure as yet. There is a lot of research globally and in New Zealand going into that. We focus on helping people to make time count, as we put it. So while they have the disease, and help them to deal with it. It is debilitating, and it is very hard on families and whānau and
it's dreadful.
Volunteer carers.
Yeah.
But, when it comes to End of Life Act, that is an individual choice, and in terms of organisationally, our policy is not to get involved in that. We will assist where we can as part of a multidisciplinary team if a person goes down that path. There's other people involved as well. You've got the local hospices, their clinical team. There's a heck of a lot that gets wrapped around a person with MND normally. If they then choose to go end of life, then that's a very personal decision that they have to undertake in conjunction with their clinical team, and particularly their GP. So we tend to sort of take a bit of a sideline on that until the decision is made, and then we will fit in and assist that person and their family where they can. But it is such a personal thing that generally we don't get involved with.
I understand that, because you will have people who are suffering from motor neuron disease who have strong religious views or strong personal views that they should be allowed, that they should not, in actual fact, suicide. And then there'll be others who feel very strongly, no, I want to go as soon as possible, because the last thing I want to do is completely immobile, effectively a tetraplegic, unable to speak and still be alive. So, I mean, there'll be, and anything, I guess, in between those two quantums. So I understand that for an organisation, but have you had members talk to you about the deficiency in the existing law?
No, not at all. And the majority of people with MND live with it. And I actually, I've been in the health sector in New Zealand for 20 plus years, and I've been in this role for the last 18 months. And I have to say that people with MND and their families, they strike me as being a typical Kiwi battler. The majority of them, even those that may choose to go down the end of life path, they battle, and they are really kind of embracing life while they can. And so we tend to focus on that with them and how we can help them to live that life that they choose. When we get into that area of if someone's, we wouldn't even know unless they specifically told us, and I'm not aware that they have, that someone's having a problem going down end of life. That's a conversation with their GP, and hence why you mentioned at the start that some medical professionals have petitioned government. That would be the appropriate way. We wouldn't. I'm not trying to dodge the question. I'm just giving you facts that we don't get involved in that.
Of the 140 people who get diagnosed every year, roughly, how many of those would you personally, as an organisation, be aware of? Is it, and that's the first question. And then secondly, you're funded by what? By charitable donations or by Ministry of Health contract or what?
Yeah, well, the first question, we're only aware of a very small percentage of people with MND that have chosen end of life. As I said before, the majority. No, sorry,
I'm sorry. I mean, of the people who are diagnosed, how many of those people who are diagnosed every year are you aware of? Is there a sort of instant, because you are the support or a support organisation, probably the primary one, do you automatically know, or does somebody who's suffering from MND get in contact with you to say, hey, I am?
Oh, you mean when they get how do we know that someone has got MND?
Yeah.
It's different referral pathways, so it can come directly from a GP, can be self-referred from themselves or family, the neurology team, the allied health team at the hospital, who will, quite a lot of the clinical level care, from secondary care comes via the community allied health team, and they will get a referral from them. Numerous ways that we get a referral, and with some people in the early stages of having been diagnosed with MND, we won't know about them for it could be a handful of months even, because they want to deal with it themselves. It's a devastating kind of diagnosis to get. So we come into play when, by whatever means, someone contacts us and say, hey, we've got this diagnosis, or my husband or my wife or my partner, can you please, we need some help, so can you please give that? So that's how we get involved. Funding-wise, we get a very small amount of funding from FICAR, which is the new Ministry of Disabled People, and but the majority of our funding to do what we do, and that's to support people with MND and to help support and fund research. That the majority of that funding comes from what I call the generosity of our fellow Kiwis. So donations, bequests, fundraising efforts, grant applications, so on. We have to work almost full time to bring the funding in order to do what we do.
Right. Which then I guess leads to the next question, and that is, there's just you, I take it, at full time?
Me, like as an organisation, MND New Zealand.
Yeah.
Oh yeah, that's right. We effectively we fall into a category of providing community-based support services for people with MND, and so that is everything that we can do except clinical level care. So the clinical care will come via what were the DHBs, so Te Whatu Ora, locally now, and generally, as I said earlier, for the allied health team, so physios, OTs, speech language therapists, so on. We have 6 support advisors around the country, so they have a fairly large geographical area, and in most places that we operate, our support advisors will be a part of a multidisciplinary team that's led by the clinical people, and we are in that team, and we do what we can to support what we call the clients. For them, it's their patients, and so we're just part of that team. So a lot of what we do wraps into 4 categories. One is education. People want to know about the disease, how to deal with it, what to expect. Advocacy, so it's going into bat at times to make sure they get things like equipment and some services that may be taking too long in times for whatever reason. And coordination or what I call connections. So it's that sort of navigation through the health system, because it's complicated and complex as it is without them having to deal with something like MND. So we sort of talk about being a guiding light wherever we possibly can. And then support, which is a broad term and quite often is about a shoulder to lean on, sometimes a shoulder to cry on, just generally being there when we're there. A lot of that is around just providing some emotional level support as best we can. So that's what we do. And yes, we're the only ones that do it around the country. And obviously we're a charity, so we're the Motor Neuron New Zealand Motor Neuron Disease New Zealand Charitable Trust, and so we're a full charitable trust, and we just like lots of trusts in the health sector and non-government organisations, we just do the best we can with what we've got, and like most, we believe we punch well above our weight.
Well, it's a difficult task. I don't envy because the amount of motions that families go through, and also it's without gilding it. To be perfectly honest with you, I had somebody very close to me die of motor neuron disease. I watched them waste through that disease. I wouldn't wish that end on, or that process on, my worst enemy. It is just appalling. What could make the life of motor neuron diseases, or the end of their life, easier? What do you see as the great deficiency in existing policy and services?
I think it possibly comes down to what Te Whatu Ora has been set up to do, that the health restructure, if it can be achieved, is really just doing away with the tyranny of the postcode. And because where you live, and it's frankly, it's not just about MND, is it? But where you live can determine what level of health service you get, and how timely you might get that. And MND has an added, you've just described it. Has that added dynamic, unfortunate dynamic of, a person can deteriorate really quickly. Some live for a lot longer. Stephen Hawkins is probably the well-known outlier of living for a very long time. Some can live 10, 15 years and actually live a reasonably good life in that period. Others will go sooner and find it much tougher. So there's no one size fits all with this disease. I think one of the key areas has got to be around getting faster diagnosis. There is a challenge in the sector, and like everything else, workforce is a factor, and we just don't have enough neurologists in New Zealand to meet the demand for the whole range of neurological health issues that our New Zealanders have. 1 in 4 New Zealanders have some sort of neurological condition, and MND fits into that. So we need more neurologists, and we need a much quicker time frame from when the GP refers through to getting an actual diagnosis or not. Some people can be very stressed for 6+ months and then get the tests and find they don't have it. Of course, that's a relief, but then then what do they have, so that they fall on that track. But one of the biggest things I would be asking for is being able to speed up the diagnosis process right across the country. So it didn't matter where you live, you could find out within weeks, not months. And when we know what the trajectory of the disease is, whilst it's no one size fits all. We've got a general journey that the disease will take, that people will take when they have the disease. So the sooner that they know that they have the disease, the sooner we can get involved, us and the clinical people, and just help them to deal with it sooner rather than later. But that would be my wish if I had a magic wand, Michael.
Wow. All right. Thank you very much for joining us for this, Scott. That's very informative. I appreciate the time that you've got, and I wouldn't wish this disease on anybody, but I wish you well in your endeavours. There's Scott Arrol, Motor Neuron Disease New Zealand. I would not wish that disease on anybody. It is, So, but it does strike me that if I did have it, and, I may well get something like this, can I just say that I want to have that voluntary euthanasia option available to me straight away, thanks very much. And to think that we are denying it currently because of the way in which the disease progresses to the group of people is just inhuman.